More than 50,000 people have now died in America with coronavirus. It comes as one of the world's biggest manufacturers of disinfectants warned people not to follow President Trump's suggestion that injecting themselves with it could treat coronavirus. One leading company said under no circumstance should its products be put into human bodies. The president today said his remarks have been sarcastic. Our North America editor John Sopel has more.
Controversially, some of Florida's beaches reopened last week, but maybe it was a smart thing to do. According to new research conducted by US government scientists, sunlight, heat and humidity dramatically reduce the life of coronavirus in the air and on hard surfaces. The scientists said it acted as a powerful disinfectant. And that led the president to muse on whether disinfectant could be used inside the human body to kill the virus.
And then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning? Because you see it gets on the lungs and it does a tremendous number of the lungs, so it'd be interesting to check that.
The president's chief medical advisor looked as though she'd have liked Harry Potter's cloak of invisibility.
In a minute, 1 minute.
New Lysol spray disinfectant.
For over a century, Lysol has been one of America's top-selling brands of bleach. But today, in 2020, the manufacturers felt forced to issue a statement saying, under no circumstances should people ingest disinfectant. Doctors, health professionals and politicians are similarly disbelieving.
So very clearly, disinfectants are not intended for ingestion, either by mouth, by ears, by breathing them in any way, shape or form.
Okay, thank you.
But today the president has sought to explain away the controversy by asserting that he wasn't actually being serious.
But I was asking a very sarcastic question to the reporters in the room about disinfectant on the inside. But it does kill it, and it would kill it on the hands, and that would make things much better. That was done in the form of a sarcastic question to the reporters.
Another question being asked forcibly is whether now is the right time to reopen the US economy. In Georgia today, hairdressers, nail salons, tattoo parlours were able to resume business, even though coronavirus is still a serious problem in the state. Now, leave to one side the question of whether sarcasm is quite appropriate from the presidential podium in the midst of a pandemic. Donald Trump's account is not exactly what happened. I was at last night's briefing and his remarks were addressed entirely, not to the reporters, but to his chief medical advisor and an official from the Department of Homeland Security. And he seemed deadly serious. Now, the White House has been scrambling all day to come up with an explanation that will withstand scrutiny. It's not entirely clear that this is it.
John Sopel, thank you. Turkey is in lockdown with restrictions in place affecting most of the population. The country has the 7th highest number of confirmed cases in the world, but fewer deaths than other countries with a similar number of cases. The authorities say the outbreak is under control, but medical sources have told the BBC the real number of deaths is not being reported, as our international correspondent Orla Guerin reports.
The new landscape of COVID-19. Istanbul under lockdown this weekend, like much of Turkey, trying to shut out an invisible killer. The official death toll here is relatively low at 2,600, but medical sources say the real picture could be a lot worse because Turkey only counts those who tested positive for the virus. This intensive care doctor tells me he has treated about 100 COVID patients. We cannot reveal his identity, and an actor is voicing his words.
Not all patients test positive. When we try to register patients who test negative in the system, we cannot do it.
How many deaths of COVID-19 do you think are not actually being recorded in the statistics?
Only half of our patients who died from COVID-19 have that listed as the cause of death. We have to multiply the official number of deaths by 2. Playing with the real statistics creates a perception that the process is being handled very well.
Turkey has more intensive care beds than many European countries, and a much lower fatality rate from the virus. It denies deaths have been underreported.
Biz bugüne kadar şeffaf bir şekilde
The Health Minister, Faratin Koja, says the country has given the World Health Organization the information it wants in a transparent manner and will continue to do so. But the WHO recommends that probable cases like Turhan Kaya should be counted. The Turkish actor died last month. His son Theo told us he had all the symptoms of COVID-19 but tested negative, so it wasn't on the death certificate. Theo is bereft without him.
He was charming, he was a real gentleman, and he was an incredible dad, a really good best friend, and I mean, he had a lot of people who loved him because of that. I mean, he would give you everything and not ask anything in return. I mean, no, he was incredible. I mean, truly.
Obviously, you have spoken out, and I know you spoke out before on Twitter. I wonder, do you feel like this is something you have to do in memory of your father?
I do it for my father, but I do it for a lot of people who hasn't lost their father yet, and I hope they never will. But I do it for my dad, but I do it because I would know that my dad would have done the same thing.
This is a holiday weekend here, but like no other. The Turkish Medical Association says shedding more light on the number of deaths will help the country emerge from this crisis.